أحب أشكر دكتور سيد عبد الحميد ودكتور حمدي تمام على الدعوة الكريمة. يعني هنخفف الوطأة شوية وهنلتقط الأنفاس، ناخد حالة خفيفة كده. It's a neglected distal femur fracture in a child. For introduction, fracture femur usually classified according to the location as subtrochanteric shaft proximal, middle, and distal third, supracondylar and distal femoral physeal fractures. Fractures occur most frequently in middle third. According to Hinton et al., the annual rate of femoral fractures in children is 20 per 100,000. With regard to the age, the distribution was bimodal, with peak at 2 and 17 years. Boys had higher rates of fractures than girls in all ages. Our case presentation is a male child about 5 years with a history of falling from the third floor. There was a head trauma and fractured distal femur. The patient was comatose and admitted to the ICU in another place for about 1 month until general condition is improved and he became fully conscious. This is the early X-rays with the fractured distal femur. Severe shortening and overlap, and he unfortunately treated in this period of ICU admission by simple slap, which leads to malunion of the distal femur in a varus and overlapped shortened position. And this is the shortening. The patient presented to us by limbless discrepancy, shortening about 7 centimeters, malunion, soft tissue contracture, and muscle weakness. This is the clinical photos and the preoperative X-ray with excessive callus regarding this period. By reviewing the literatures, many papers talk about the fracture healing by excessive callus in patients with head trauma admitted to ICU. Our aim and method of treatment is to do reduction of the fracture without traction on the neurovascular bundle by shortening the proximal fragment. And correction of the malunion and correction of the limb length discrepancy by gradual lengthening by using a simple Elizarov frame composed of 2 arches and 6 shunt screws. This is our plan to disrupt the callus, to do traction to correct as much as we can, then excise the distal part of the femoral shaft to do anatomical reduction and applying the frame. This is how the frame looks. Simple frame by 2 arches and 6 shunt screws. This is immediate post-operative with good reduction and application of the frame, which we shall use for lengthening. We start the gradual lengthening until the limb length equality was reached. And we instruct the patient to continue regular follow-up and keep the frame until complete consolidation. Unfortunately, they were divorced على عكس الحالات اللي فاتت. هنا البيرنتس divorced and the child didn't continue the follow-up.
يعني تيومرز احسن من الديفورميتي.
بالظبط. تيومرز بتجمع الديفورميتي يتفرق. The frame removed early in another place, and after about 8 months, the child came up to us by this presentation. Increased anterior bowing of the femur and wide limbing due to early removal of the frame before complete consolidation of the regenerate. We try to convince the mother to leave him for remodeling to be corrected gradually, but she insists to do correction, and accused by the father that she is the cause of the deformity. And we decided to correct the deformity by doing osteotomy and intramedullary nails. Translation inevitably occurred, and this is the early union by correction of the deformity and the limb length. This is complete union after 3 months. And this is the gait of the patient before removal of the Nancy nails. The prominence of the Nancy nails is obvious. And after complete union, after 6 months, we remove the nails, and the patient walks nicely. And we hope they return again. Take home message, fracture healing in children is so fast. In patients with head trauma, excessive callus formation occurs. Provisional reduction is so important if surgical intervention had to be postponed. In neglected cases, if acute anatomical reduction is dangerous, acute shortening and gradual lengthening is a good solution, and Elizarov is an excellent tool in these cases. Thank you.